Good morning, everyone, and welcome to the Cox Business Executive Discussion Series. As Women's History Month comes to a close, it's fitting for us to spend time today recognizing and acknowledging the critical role that women play in our households, our workplace, our economy, and our lives. Today's topic, the impact of COVID on women in business, is an important conversation to have, and we hope that you leave today's discussion with an understanding of diverse perspectives, actionable ideas, and useful resources to ensure that we continue to support the women in our workplace. Thank you in advance to our distinguished group of panelists for sharing their insights and expertise on the topic. The Executive Discussion Series is not possible without our partnership with John Donnellan and his colleagues at Inside Business. We thank them for developing this discussion as well as every other one together with us, and for bringing it to a wider Virginia audience that now covers Hampton Roads, Northern Virginia, Roanoke, and neighboring locations. Most of you are already familiar with our moderator, Cathy Lewis. As we continue to gain new attendees to the series, I want to reintroduce Cathy and celebrate her energy and ability to skillfully guide these conversations. Cathy is one of Hampton Roads' most veteran and well-known media professionals. She is the founding host of Hearsay with Cathy Lewis on 89.5 WHRV. With expertise in civil discourse, community engagement, and communications, she's also a popular speaker, trainer, and facilitator of corporate and community conversations. If you're interested in learning more about her and what she has in store for her audiences, please visit her website at cathylewis.com. Again, I want to thank everyone for attending today, and I now turn you over to Cathy. Cathy?
Tom, thank you so much. I was thinking about how long we've been doing this, and I just feel like these conversations get better and better. And in this particular instance, we have a moment where we are really able to certainly be topical, but to also be timely. This is a moment after the extraordinary year we've lived through and the extraordinary months that are still ahead of us as we see this hopeful light at the end of the tunnel, where the impact of COVID on women is really profound. And in the course of our time together this morning, we'll get a sense for that. We have some great poll questions for you. We always like to engage you wherever you are in this great Commonwealth with some poll questions as well. First, though, I'm going to introduce our speakers today, and then we'll hit our first poll question, which is a really easy one. We don't get into the examinable material. No, we don't get into that at all, but it's a really easy question for you. So let me first, though, introduce our panelists today. Abby Hamilton is the president and CEO of the United Way of the Roanoke Valley. One of the things that she's particularly concerned about is this issue of caregiving for women, which has really been such an issue over the past 12 months. Dr. Barbara Blake Gonzalez is with us today as well. She's the Chief Administrative Officer for the Draga Center for Economic Analysis at the Strome College of Business at Old Dominion University. She's really been taking a look at the numbers, not just women in general, but specific groups of women and how this epidemic has impacted them. Kathy Alvarado is the CEO of a tremendous HR consulting firm in Reston called Helios HR. And Jane Dittmar is the Deputy Chief Workforce Advisor for the Commonwealth of Virginia. And she'll be with us this morning to talk about some of the issues from a policy perspective that we might be able to engage to minimize these impacts moving forward. We are ably assisted by Sarah Kingsley this morning from Inside Business. And Sarah, let's go ahead and put that first question. This is the easy one. It's a pretty simple one, and it has to do with whether you believe the pandemic has impacted women more than men in the workforce. My goodness, that's a very simple question for you to get us started this morning. But in the course of our morning together, we'll also talk through issues about the difference between what leaders think they're doing and how leaders think they're helping in this moment, and what women think is happening. Believe it or not, there's a difference there. I know that will probably come as a shock to you, but there it is. So the question is, do you believe the pandemic, oops, I lost everything there for a moment. Do you believe that the pandemic is more affecting women or men? So that is the issue for us right now. And so let's go ahead and Sarah, do we have a status update on that?
Yes, 70% of our attendees have voted and 97% say yes.
Wow. I suppose I'm really not surprised by that, but that gives that, you know what that shows? That shows that this is a very, very good topic for conversation. While I have you there, Sarah, and while you have the polling questions up, let's go quickly to number 3. Because I think that will also inform the conversations that we have with our panelists this morning. And what we're thinking about here with question number 3 is the direct impacts on women. And as you are in the audience this morning, I hope you'll think about this from your own perspective, what it is that has had the greatest effect on you. It's certainly possible that you have not been affected in any way personally, but you may have been in a situation where you have team members who have been affected by this. So Sarah, this is how we'll know it's live. Are you able to do question 3 or do we need to wait half a second?
Is this the one about as employers or biggest?
As employers, exactly.
All right, here we go.
Okay, there it is. If you are an employer this morning, what have you seen more? Have you seen reduction in hours? Have you seen, we've got 2 reduction in hours, so you can do either one you want there. Have you seen women leaving the workforce, or have you seen no change in what's happening in the workforce? Give us your answers on that, and then we will engage the conversation and find out whether your sense of things is matching what the statistics seem to reflect. There is a lot of research underway right now on these questions about specific impacts for women. And I think so many of us probably intuitively knew that women typically have more of the home-based responsibilities. That's been proven statistically, even though that balance is improving, that still is the case. And it certainly seems like COVID-19 is one of those things that has really affected that. And so we'll talk a bit about that as well. We're also going to talk in the course of our morning about the impacts of women moving forward. So if you're in the course of this past year, and you have had impacts, whether you reduced your hours, whether you've left the workforce, whatever it is, we're going to talk a bit about what that trajectory looks like for those women who have experienced a change in employment status. Again, whether it's reduced hours, they're leaving, they're doing other things. And so we'll talk about that as well as some of the upsides that I think this past year has brought as well. Okay, Sarah, where are we on this poll?
We have 44% of our participants have voted. And so far, 35% say no change. 29% say leaving the workforce. Those are my cats, sorry. 24% say reduction in hours, and 10% say, we had a duplicate, reduction in hours.
So let's say 34%. 34% have seen reduction in hours, 9% leaving the workplace. Thanks, Sarah. I appreciate that so much. Now that we have sort of a sense of where we are with some of the potential impacts, I am very glad to introduce, again, Dr. Barbara Blake Gonzalez. Barbara's with us today from the Dragas Center for Economic Analysis at the Strom College of Business at ODU. Barbara, you dig deep into the statistics on this, and the question we just asked had to do with our attendees' sort of general sense of things. But what do the statistics tell us about the impact on women?
Well, first, before we dig into what we're looking at right now, you have to know that, federal statistics for the state level and even the MSA or the Metropolitan Statistical Area, they're forthcoming. That's emerging, right? And so we literally just had a release within the BLS, the Bureau of Labor Statistics, from the local area unemployment statistics office just last week. And these were for average salaries and unemployment data for 2020 for the Commonwealth of Virginia. So, that we're gathering this real time. This is emerging, and so it's going to be a while before we can really get that statistical sense of exactly what's going on. But in what was just released last week, we can see that women, and particularly women of color, have been affected. The rates speak for themselves. So you have a double-digit unemployment rate for Virginia Hispanic and Latino ethnicity women, a little over 11%. Women from 20 to 24 years old, over 13% unemployment rate, 25 to 34 for all women, 7.9%. And if you look at the rates for men, much less, total white men, 5.2. So we can see African-American, not quite double digit, but over 9% African-American women unemployment rate coming through the BLS and the local area unemployment statistics report from last week. So we can see this. And I'm particularly struck with your last poll question, because saying, well, was there a change? And, myself as a full-time employee with 3 children, for me, there was no change, right? You've still got to keep on doing what you're doing. If you want to stay employed, you've still got to take care of the kids. You've still got to put in your work. And so I'm not surprised if there would be sort of a big difference between, well, nothing has changed, we're plodding along, or we can't do this, we have to leave. We have to leave the workforce, right? And so we're still getting that sense of exactly who has left and why, but emerging statistics, they are telling us, the data are telling us that women, young women, and women of color are having.
Barbara, that's such a great point, because maybe what we should have had the fourth question, or the fourth option, was no change, but I'm struggling, because what you're saying is there are people who are doing it, but it has impacts and it's stressful. Speaking of all of that, Abby Hamilton is with us, president and CEO of United Way of Roanoke Valley. Abby, I know you're particularly concerned about the additional impacts, very much what Barbara was describing, on women who are trying to hold down jobs, but are also having either the same caregiving responsibilities or increased and different caregiving responsibilities.
Yeah, so I love that Dr. Blake kicked us off with some statistics, and we at our local United Way are just coming off the heels of actually completing an ALICE COVID survey. So essentially surveying residents within our region about the impact that COVID has had on their household. So we did that in February. I'm going to give you.
Before we go too much further on that, I just want to make sure that we let everybody know what ALICE means. It's not not individual, but it's a really important group of people who are often disproportionately affected.
Yes, so ALICE stands for an acronym that is Asset Limited Income Constrained Employed. So basically you are looking at people who are holding two or more jobs, but still can't make ends meet. So we were trying to survey, the survey was about all residents in the region. And I'm going to give you a sneak peek of some of the stats in there, particularly for households that had children. The top 3 factors that they cited, which is not going to be a surprise to anybody: childcare, housing issues, food access, and paying off debts. And who is always responsible in the household for those 4 areas? It's the women. And so it's also not surprising that women, particularly those that have children, are reporting more instances of mental health issues, depression, anxiety, and that they're also spending more time doing household chores, supporting kids when they're at home with distance learning or other things like that, and still doing some of the regular tasks that they had as leaders of the household.
You mentioned depression and mental health aspects. That the ALICE population in particular has had a tough row to hoe every day before COVID ever showed up. So it's sort of hard to imagine in some respects the additional degree of stress that COVID puts on that population in particular. But we should note that these statistics around depression and mental health effects are across the board. Is it your sense that there are enough and appropriate resources to deal with that? Do you have the sense that people either know what those resources are or whether they're available in the first place?
Yeah, I think that's a great question, because even before COVID, we've already had a shortage of mental health services and support. And so when we get to our discussion around policy, I think we will certainly have some juicy discussions around that, because it's going to be an ongoing need for us. And I think what providers and communities are doing largely in the state is, one, being creative about expanding access, right, in ways that have not been traditional. So not just in person, but doing this telehealth or in other settings, and actually developing solutions like warm lines or helplines that people can have access to. But I think those two that you hit and brought up are really important. Like, do people know where they're going? Is it acceptable culturally for them to acknowledge, especially for us women that like to do it all, right? You know, is it acceptable for women to say, hey, it's really my child that needs help, or my so-and-so that needs help, but not me. We always put ourselves last, which is also a challenge for us.
It is such a great point. And again, this is something that predated the pandemic. It's important to remember that. Before we talk with Cathy, because I'm really intrigued by her perspective as an HR professional and how she's navigating this on behalf of her clients. Sarah, let's go to question number 4, if we might. Can we go to question number 4?
Yes.
All right. Do you feel, and this will set up beautifully what we have coming up, which is, do you feel your company is doing enough to support your work from home situation? Do you feel your company is doing enough to support your work from home situation? That's the question, and this will lead so perfectly into our conversation about what is a pretty sizable gap between what workers think and what employers think about how they're doing. It would not be the first time that we have a different vision of ourselves than perhaps others do. That's always one of those shocking realizations in life. So again, the question, do you feel your company is doing enough to support your work from home situation? Okay, Sarah, how are we doing with responses to that one?
We have 55% of our attendees have voted, and it is a resounding 76% yes and 25% no currently.
That's really interesting. Okay, so that's good news, because it sounds like most of the folks think that their employers are doing enough. Very interesting result there. We'll wonder how the 25% are feeling about that. But let's go back to Cathy Alvarado now, who's the CEO of Helios HR, which is an HR firm in Reston. Cathy, I wonder what your observations are about the surveys that you're doing and that your colleagues are doing about how employees are feeling about the degree of support they're getting, and about how employers are feeling about that.
Thank you, Cathy, for that question. So it's interesting. On our first poll question, where we had the duplicate question, I would expect, or maybe I'm assuming this, and it may not be true, but potentially that line that we didn't get in there was the question of not a question about has everything dropped, but how many of us have taken on more responsibility. I would assume that was probably the question that was missing, because my perception is, in the kind of work we do and the kind of clients that we support, a lot of them professional services, nonprofits, government contractors, they're working and people are overwhelmed. And so why are they overwhelmed in this setting, right? That we're still, yes, we've been able to work, a lot of us working remotely, but it's in a very different environment. And it's interesting that when we talked about kind of the anxiety and the mental health, I discovered that the World Health Organization last year has classified burnout as a syndrome. I'm sure Abby knows this, right? As a syndrome, and now it's an international classification of diseases. Burnout, something we've always talked about, but now it's actually considered a disease. So we see a lot of people struggling with that capacity, right? And the women especially, because as we know, they do tend to be the primary caregivers, whether it's for their children. We have homeschooling now that's happening. That's very complicated. Lack of babysitters really for younger children, right? How do we do that? And so it is what we're seeing that people in the workplace, what employees are really struggling with are definitely things like anxiety, over layoffs, furloughs, the uncertainty, the financial insecurity that brings. Whether it's happening or not, there's a concern about it because there's still so much. There's still so much that is not known, right? Where everybody's very excited. Not everybody. Many people are very excited about the vaccine, right? Many people see that as hopeful. And there's still a lot of uncertainty. And in the absence of certainty, it creates fear and anxiety. So we are still seeing that. And when you ask kind of what are those things that they can do, and I was so grateful to hear that 76% of our attendees feel like they are getting the support that they need. 76%, that's awesome. What we have found and what we encourage among all our clients and what we do at Helios is give what we call maximum flexibility. Like flexibility in a bring your whole self to work environment, right? A bring your whole self to work culture. And we have always foundationally had that for the 20 years that we've been in business and encourage that in our client base. So what that means is be your authentic self. And for us, in our values at Helios are demonstrate caring for your community, yourselves, our organization, your teammates, and your clients. Operate with intention, be engaged, got to be engaged to be a member of the Helios team. And when we do all of these things, we make big things happen through a growth mindset. Well, if we're really demonstrate caring and bring our authentic selves, we need to know how to help you. So we encourage people to share what their challenges are. And some of them are very personal and they share it with the team so that we know how to help them. So the flexibility is really something very specific. So our clients were sent a letter from me directly at the beginning of the school year last fall to say, look, it was entitled Supporting You, Supporting Our Team. We are going to be working flexible hours because we've got to support our team so that they can make it work with their family situation. So if you get emails from them at odd hours, don't be disturbed or concerned, and we promise you it will not negatively impact our engagement. And they were so supportive, and said, wow, we should be doing this, Cathy, too. Thank you. We'll offer that flexibility for our team. And it's really working. So that's a big piece of it. And knowing what your people need, right? Having a lot of one-on-one conversations with people and knowing personally which each person needs. I know an organization with 1,000 employees and their head of HR is making sure she knows what every single one of their people need so that they can try to meet those requirements.
That's just such a great example of a way that companies can do this and leaders can do this. I know there was a survey where 74% of employers felt they were doing a great job, but only 39%, almost 40% of the employees thought they were doing a great job. And again, there's no blame, no shame in this. Sometimes it's a question of one not knowing what the other needs and not asking those questions. So I so appreciate your digging deep into that a little bit. The other thing I want to ask you about, though, has to do with, you said burnout is now being classed as a disease, and we're also, I mean, that's stunning. And we've noted some of the mental health complicators here. As you think about the whole aspect of mental health and burnout, what specifically does that look like on the job? I think a lot of us have the sense that we are, this is a little bit of a challenge, but by golly, we're going to get it. What does it look like, though, as a practical matter on the job?
That's a great question, Cathy. Disengagement, right? When you start hearing from them less, they're not as, they're not present maybe. In this environment, we give a lot of opportunity for people to connect with each other virtually. It could be that they're really struggling and not comfortable talking about it. So how engaged are people who used to have energy and participate? Are they shrinking? Are you not seeing them as much? That would be certainly one area. And then knowing if knowing how it's really about knowing what everybody needs individually. If you haven't heard from them, that's a challenge. If you're concerned about them, are they comfortable telling you what they need? Are they comfortable telling what you need? You know, what are clients saying about their interaction with them? Are they still showing up with the same level of energy, or are people just really struggling with getting out of bed in the morning? But I think if you know your people really well, you sense it, and then you start asking them about it. You know, this is the time when people, sometimes in the HR hat, sometimes is not helpful if all we are concerned about is the regulation or the risk. We cannot let risk concern us in reaching out to people. We've got to ask people if they're okay, and then figure out what they need in order to support them, right? Do they have the appropriate setup at home to really do the job they need to do? We've seen a lot of our clients, and we have done this as well, where we gave people a stipend and we said, take what you need, buy what you need to be comfortable at home, because the person in the condo might not have as much luxury and enjoy working from home as the person who has a lot of space in their home, right? So what can we do? Did that answer your question?
Absolutely. That's exactly what I was looking for, because one of the things is that strikes me is that this is a tough issue for people to even acknowledge in their own selves. And so it seems like to me there's an opportunity here for leaders to create an environment where that is not a career ender, where it's a support and an opportunity to engage people deeply in this extraordinary moment and lay a foundation for the future when we hope things will be much better. Thank you for that, Cathy. Jane Dittmar is the Deputy Chief Workforce Advisor for the Commonwealth of Virginia. Jane, I really appreciate your being here today, and Abby was interested in this as well. What are we seeing on the horizon in terms of policy issues to deal with some of these differentials?
Thanks, Cathy, and I've really enjoyed the comments from Barbara and Abby and Cathy. I might relate to some of them. The public policy area is an interesting one in that we look at every Virginian as the constituent of ours, and we look to serve them. In terms of the workforce area, which is more specifically what I am involved with in the governor's office, we control about $1 billion a year pre-pandemic in workforce training and service delivery to Virginians through a network of service providers and also our own 15 regions where we have offices to help with training and reemployment services. So we've got an engine that's incredible, and the way we were using that engine pre-pandemic was because almost everyone that had no or fewer barriers were employed, we were able to drill down on the least employable Virginians. And that was a job that we relished. We were hoovering up people into the workforce system, sometimes for the first time, who previously had been unattractive to employers. And now all of a sudden, because they were scratching everywhere for anybody who could work for them, we had attractive new candidates for them. And that was true all the way through January of 2020. Our February figures showed that as well. And then all of a sudden it got turned on its head. It was an amazing thing to have our brains have to cope with that, because we had been doing something full speed, and all of a sudden we had to stop, brakes hard as possible, and reinvent ourselves. And so we've been working on that. In public policy, to say the obvious, we have two primary methods of creating change. One are carrots, and that's usually through funding, incentives, and the other are through sticks, and we need to work with generally the General Assembly, who creates new regulations to protect workers. We've done both. A third area is to look at innovative ways to cope with new situations. And I think Cathy was talking about the private sector, what the private sector is doing. What we did was excuse me, clearing my throat. What we had to do was we had to look at how we were delivering services just like the private sector, and we went to delivering them through technology. And then another thing we did was we said, there's some innovative programs out there that we might be able to take statewide. And Abby, I think you may be familiar with Network to Work in your area. We are looking at a new proactive position for our workforce centers rather than waiting for people to come to us. We are going out and to them in their neighborhoods, in their communities, through ambassadors in those communities to bring them in for training, retraining, and placement. I think that one of the things we looked at in terms of new protections for workers that the General Assembly did a great job on is that in a poor economy, we can see behaviors from employers that include changing full-time W-2 or benefited jobs into gig work. And that's okay as long as it's legal, but there's a rise in cases of misclassification. So last year, the General Assembly during the regular session and the special session passed misclassification regulations that put teeth in protecting workers from that. This year, we finished a full 2-year report on the gig economy. Good economy, gig jobs can be a choice for people for many reasons, but they generally are not benefited. So when we have women going into these gig jobs, they are the least protected. And so we worked on portable benefits, a portable benefits package which would travel with them rather than with staying with their employers, like healthcare, like retirement, like childcare, etc. And then I think that it's important to look at the $1 billion. That has changed. Has it fallen? No. We still have that, plus the CARES Act, and then the new COVID Relief Act will pour much more money into our workforce system where we can partner with the private sector. Training becomes essential, especially for women who have been out of the workplace or have gone to gig work or have reduced their hours. They're not being trained by their employers. They are losing value in the workplace every day. They are not full-time. So the training systems that we have in place, our partnership with community colleges, our 4-year colleges and universities are all looking at how training is vital for the emerging workforce post-pandemic. I'll stop there. Those are our tools. Those are our strategies. We have a report on our website if anyone's interested. It's called Rev It Up, REV, Reemploying Virginians. You can locate it by Googling our governor and looking at his cabinet and looking at our area, which is workforce. And it has many strategies there that we're working to fulfill.
Those are being deployed, by the way, through regional employment centers and also in great connection with the community colleges across the Commonwealth as well. So that's been a partnership that one hopes will bear great fruit going forward. Jane, I wonder, as you think about it's very tempting to leapfrog to, we're all back to normal, everything's great, but that's obviously not the case. But when you think about emerging to that great good day, are there categories of women that you think are going to have a harder time with that than others?
Yes. Well, first of all, let's look at I think Barbara was talking about the Bureau of Labor Statistics. We look at that, we crunch that all the time. There's a rule in our area of government that if you don't have data to back it up, it's only an opinion. Don't come to us with your opinions. And we have a wonderful powerhouse data tools through the Virginia Employment Commission. That's the labor information system that we have. As of the end of the year, and Barbara, please chime in if you want to add some information to this. We had a falling unemployment rate. And when you pick that apart, the top quartile, which were the highest salaried individuals, if the national in January was about 7% unemployment, the top quartile was 4%. And the bottom quartile, where you find many women, was 17%. So when you look at these averages, it doesn't pull out unless you drill down on the demographic that we're talking about today. Part of the reason why women are in that 17% is exactly what everyone's talked about before me. Part of it is the lowest quartile are those service sector jobs, and they are far more likely to be populated by women than not. When we thought about, all right, we have to change gears here, who's going to be impacted particularly by the pandemic? Who's going to have the slowest recovery? Who do we need to do a rifle approach with rather than a shotgun? And those were 3 categories. Emerging workers, particularly those that lost a year of high school due to remote learning and lack of administration in their homes, so job training there. Older workers, we see that in every recession, but we knew we were going to see it here. And then those with barriers, who we were always. If you drill down, women in each of those categories are the most unfortunate. And so that's where we are going with our focus. I can expand on that, but let me turn that over to anyone else who wants to comment.
Yeah, this is such a great point about the individual differences, and it's a problem with statistics that if you're going to look at the big number, it really can change things when you look down at that. Barbara, I don't know if you are. It looks like you were trying to unmute there, so I was just killing time till you got there.
Thank you. Yeah, so I think what's really important here, and I'm so glad that Jane has introduced this topic, is we really need to talk about, when we talk about supporting women, we need to look at that huge spectrum, right? And who is really suffering, if you will, even though I think we've all touched upon this, you know, this is a pandemic that no one expected. Everyone's just doing their best. Everyone, regardless of gender and caregiving responsibility, we're all struggling, right? This all knocked the wind out of all of us. But what's really important here for working women is, are you a full-time employee who is salaried that can telework? Or are you a full-time or part-time employee that is hourly and may not telework? And especially in this context of you have young children who are not in school. What are you going to do? What are you going to do? And so definitely when we look at populations, and you know, I've done some work with Thaler McCormick, CEO of 4 Kids, when we talk about housing insecurity, you're talking about, I have 2 kids under 5. There is no school. There is no childcare that I can get to. How am I going to leave home every day? Maybe, you know, in this pandemic, grandma and grandpa were not available because it wasn't safe. So, you know, how do they move forward? You know, I always say, you know, and it's quite well documented in the literature, we have this motherhood penalty, and it's now really kind of evolving into the caregiver penalty, where it's a lot of women are doing a lot of work. They're just not being compensated for it, right? There's not that monetary compensation. And as everyone has kind of spoke to, is that this has significant long-term implications. Retirement, security in older years, if you've literally had to step out of the workforce because you are caring for mom and dad, or you're caring for your kids. And so this pandemic is not going to impact everyone the same. We know that, but definitely those hourly female workers with children or with family members that they have to care for, it's incredible. And really, we're still looking at those statistics and really looking at that data just to see how far this has set those women back.
Abby, you're working with a wide range of population in the Roanoke Valley, but have a particular focus area around that Alice population that you described earlier. It sounds like it's going to be the population that potentially, it can be all ages, but older members of that population, it sounds like, are going to have a bit of a more difficult time coming back into the workforce if they have had to take a break for this moment. You've also got single parents, certainly, who are extraordinarily stressed in this moment. As you think about this issue moving forward, what can we do, either from a policy perspective, from an employment perspective? Where do you see opportunity for this to change so that these women are not always on the bottom of that ladder in terms of impacts?
Right, that's a great question. And I think the pandemic is really opening up opportunities for not just organizations, but across the across sectors to think about this problem very differently and also to proceed in a collaborative manner. So I think about a couple of things when, within our own companies as leaders, certainly what Cathy pointed out about making sure that we have flexible work arrangements that really do respect the fact that people are, and our employees belong to families, and that we are also in the middle of a pandemic and everybody is trying to do their best. And so making sure that we have supports in place, EAP, things that they can benefit from, paid leave, things that will allow them to focus on the duality and the wholeness of themselves as workers, and then making sure that we as employers are also trained and as supervisors too, to manage people in that manner, right? To be able to treat people with flexibility and with respect, and to recognize the needs that they have as family members. And then outside our own companies and our own family units, I think about opportunities for partnership with local government and other places. A lot of conversation around economic development, even locally and in our region, has been talking about approaching things from a community development perspective, right? Like, how do we strengthen the workforce and strengthen business by making sure that we truly are investing in the totality of the employees that are there, and focusing on quality of life, things that they care about, health and safety, healthcare, childcare, food security, those kinds of things that are important to people that also can easily impact their productivity if they're not in place. And then I think about, as we're kind of thinking about how we shape our approach to economic development that way, I think about policies and the great partnership that we already have started with the state in terms of the governor really prioritizing expanding childcare access. I mean, that's been one of his really strong agenda items, which is in recognition of not just the important role of childcare in terms of preparing workforce, but it also is a way to provide equal equity, right? Like for the future. And so policy-wise, strengthening those infrastructures that allow some of these support systems to be in place. And certainly my favorite topic of, like, and we talked about this already, like mental health. How do we truly look at the entire network that we have? And it's really a national and a global crisis when there are not enough providers, there's not enough funding. How do we set up an infrastructure while we are in a pandemic that allows us to sustain a better infrastructure into the future and addresses a lot of these weaknesses in the access points and even acceptability of talking about and receiving help through mental health services?
It's such a great point. And Sarah, let's go to another poll question, because as we're thinking about the impact of the pandemic on each of us, and again, noting that is going to be very different, whether we are salaried employees who have some level of flexibility, or whether we are in that Alice population, or whether we are someone who has to leave the house to do our jobs, those folks who are on the front line of service delivery. But let's go to question 5, which has to do with looking forward. Are you contemplating a change in your job or career based on the impact of the pandemic? And, you know, this could be a question that comes to you in the wake of a realization that the job that you had is not going to be the job that's going to be available to you down the road. And by the way, if that is your circumstance, or if you're working in a business where you recognize we have a challenge here that, despite our best intention, we're not going to bring that job back, or we're not going to bring that type of work back, do definitely check out that workforce website for the Commonwealth. There are great resources and programs to retrain folks for a future if their job does not look like it's going to make it to that day. And that's a moment of, of stark realization, but it is there. Some folks are also contemplating a career change based on where they live. Are you thinking perhaps that you might move to a different place where you're either going to continue to do your job but from a different location? So this is the question we have before you. Are you contemplating a change in job and career based on the pandemic. As well, a reminder that we have a question opportunity for you. If you go to the control panel, you'll see a toggle that says questions. If you want to just open that up and put your questions there, we'll be glad to take a look at those. Okay, Sarah, where are we on this question? Are you contemplating a change in job and career based on the impact of the pandemic?
So our attendees, half of them have voted, 74% say no. 7% have already made a change, and 19% said yes.
So they're thinking about it. You know, these moments, crisis points, and thank you, Sarah, these crisis points in our lives can really be opportunities, you know, for us to think through things differently, for us to take another look at how we're approaching things, and whether the mode of our lives that we entered the pandemic or any other sort of circumstance still makes sense on the other end of it. And that is an introspection to which we are all invited. Cathy, I wonder, as you think about that issue and moving back into the workforce, either in the same job or a different job, we know that there will be women who have had, if not a career interruption, certainly a career reduction over this past year. How do you recommend they position that for employers? What do you recommend in terms of strategies that can help them shorten that curve when re-entering the workforce? I think you're muted, so maybe if we can unmute. Yeah, there we go.
I'm unmuted now. I think employers are going to be more gracious and forgiving when they're looking at what happened in certainly 2020 and the beginning of 2021. I think that story, I wouldn't have a concern, especially if they can explain that they were the caregiver in their specific circumstances. Which is really interesting, we're seeing as it relates to the last poll question we took, is more employers are offering remote work in an ongoing capacity. And the employers who don't continue to offer that in a very robust capacity will not have access to top talent. So I think I would encourage women who are in transition or looking for other jobs to ask for that, right? To demand that, to feel that you don't get what you don't ask for. And to start with that, we have one of our practice areas is talent acquisition. And we have a lot of candidates that are asking us about, they don't even want to talk to an employer if they don't have some ability to continue to work remotely because they've been shown that they can do that.
Wow.
Yeah, absolutely. It's going to be a requirement. And I think, again, because this is a global pandemic, I would not have concerns about that gap, especially if people are if they need to stay connected to their profession, right? The self-paced learning, there's a lot of training that can be done online. So we really have access to more opportunity because we do all of it in such a virtual environment. So I think those people who are proactive in that and can take some online classes, and many of them are free through LinkedIn even. So I would encourage that.
Cathy, this one's for you. Questions come in from our audience today has to do with late career professionals. And boy, this is a group that has been hit hard. Older women being forced into early retirement without the resources or the desire to do so. Maybe they had anticipated working another 5 to 7 years and they don't see that income stream coming in. So are there statistics around that? Do you know, Cathy, or resources for those older women who maybe have been invited into early retirement as effective retirement as a result of the pandemic?
I don't have the statistics, Cathy, but I certainly see it, right? We see it as well. This happened to my mother. She was ready. She was working. She had retired, was working part-time for the school system, loved her job. It was more for her and for her social connection. She's a widow. And that really was both financially, but really from socially an impact as well. But there are community centers and the workforce investment boards, right, are in various regions that have access to that retraining, right? That's why they exist, to keep people in the workforce. So there's definitely resources, and the Commonwealth has been really great about, I mean, we live in a really strong state. So I'm really grateful that we have those opportunities here.
Talent acquisition is going to be key to every state moving forward, and there are opportunities in these fields. Sometimes I think older people get a little anxious about the idea of technology, but there are a lot of jobs in technology that we can all do, whether we grew up playing video games or not. And those regional workforce boards are just a great place to find that out. There are sectors of employment that are very targeted right now, and they're really looking for talent. And my suspicion, Jane, I wonder if you would agree with this, is I don't know that age is going to be a barrier. The need is so great. I don't think age is going to be a barrier if you can, master some of these skills for which there is great demand.
One would hope so. I think I wanted to underscore what Cathy said. As I mentioned, we looked at what are the demographic groups that are going to have the hardest time coming out of this, and we definitely identified older workers. Subgroup of that are women who are older workers. Because, if you're thinking about investing, although we do have such job turnover now among our youngest workers, if you're going to invest training, you want that person to be available for a while. You think about the older worker who may be retiring in a year or two or three, or we're near retirement, but now can't retire because of the pandemic, stripping them of income and earnings and savings. They're less attractive. And we're seeing lawsuits around the country now because of age discrimination. So that'll be a hot topic in terms of not only public policy, but in the courts, I think, in the future. Cathy, could I mention one thing that we haven't touched on? That is women-owned businesses. We're seeing a striking difference between male-owned businesses and women-owned businesses in terms of their optimism, in terms of their prediction about staffing up again, in terms of their revenue projections. But more alarming for us in the workforce field is the fact that in a survey through the U.S. Chamber and another group that we monitor, it looks like about 50% of those who are considering launching their own businesses have decided to either delay or scrap that. And that's of concern. That's of concern. Now, some of that is just not feeling optimistic right now. And as we come out, I think we may see those numbers shift. But remember that the payroll protection plan was subscribed to much more by male-owned businesses who seem to have better banking relationships, so they were reached out to early enough. So there's some issues there that probably go more through the Commerce and Trade Secretariat than workforce, but it is of concern and it is a woman's issue.
Well, that's a great two great points for us to end on here. But I want to just go around our little Brady Bunch screen here. Nobody under 20 understood the meaning of that, but it was a show in the 70s. You can go look it up on the YouTubes. Abby Hamilton, as you think about that, that's very distressing to think that people who really are interested in starting a business, because that is in a lot of respects how you get to manage and control your availability and what you do. What do you think about that? That seems very distressing.
Yeah, and I think it goes back to the problem of access to capital, right? Which goes even deeper into the root causes of a lot of inequity that we see in society to begin with. And I think about, like, what we asked a question in our survey, what resources have been most helpful to your household, which is like the $1 million question, right? And what people said, their top answer is, help me to pay my debts in the meantime while we're in the crisis situation, and help me address some of my basic needs like rent, mortgage. So the bigger ticket items that are there. And so definitely, if you think about opportunities for people to exercise more freedom, women, right, as entrepreneurs and small businesses, I think that it's going to be even more challenging because, one, you have to operate from your own home and there's limited capital to begin with. And so you're right, it is a very distressing thing, but I think the opportunity here is it will only be bad if we decide not to do anything about it. We are obviously aware of the issue. Leaders across the state want to do something about it, and so we need to strike while the iron is hot. And and connect these different pieces, because we know the different pieces that are needed. We just need to work together to make sure that that forms a real strong network that women, regardless of whether or not they're single, with children, working women, whatever, have access to.
Yeah, it's a great point. Cathy, you look like you want to jump in on that.
I do. Thank you so much. So what you reminded me of, Abby, was we talk about capital a lot and women not having access to capital, and oftentimes, especially women of color, but we don't talk about the social capital, right? So I think about myself. I started the company 20 years ago. I was a single mom with a mortgage, and I quit my job that I loved because my company was acquired, this is before Helios, my company was acquired by a group of leaders that I did not respect, so I couldn't stand it. But I had a really big network because I was so active in my community from the time I graduated college. You mentioned the Employment Commission. We used to have something called the Employer Advisory Committee many years ago, and that's how I got really engaged in my community. So I would encourage us as leaders in our community, those of you who are on this call, please think about making connections and sharing your social capital. Who can you connect? If anybody wants to look at my LinkedIn and say, Cathy, is this somebody you can introduce me to?
We understand. There we go, Cathy. I think we got you back now. You were massively frozen there for a moment.
Oh, was I?
Yeah.
I was
And it
saying
was
all these
brilliant.
brilliant things.
Whatever you were saying is brilliant, but you're going to have to recap it, and shortly.
Okay, capital. Did you hear the part about the social capital?
But you just got into that and then froze.
Okay, social capital. So we don't talk about that and leveraging our connections as leaders in our community. So people need access to social capital, and let's think about that, right? How can we help people that are struggling by leveraging our own social capital and sharing those connections and networks with them? It's really important. Just a plug. I want to encourage everybody to do that.
Yeah, it's a great point. We have just a minute or so remaining, and one of the questions we have, I think, is really important, has to do with vaccines and what companies are doing around that. We are now reaching, I think many of us have received emails from our employers saying, hey, time to maybe come back. We're going to start thinking about that, talking about that. And of course, so much of that depends on how many of us get the vaccine and the like. So Jane, I wonder, as you think about this from the Commonwealth's perspective, how important is that? And have you all thought through what happens if you have people who just are not interested in the vaccine?
So this is not my lane, but we lent one of our key leaders of my team to the vaccine rollout because it's a workforce issue. Backing up, we instituted here in Virginia, one of the first in the country, workplace safety standards, regardless of whether you're vaccinated. But we will make decisions, as will the General Assembly, about those things once we reach the point where our governor or the next governor feels enough people have been vaccinated. Obviously, it's an employer decision, but it's also an employee decision. And so we're watching that in the public policy arena right now.
Yeah. Cathy, you're the HR expert here. You're dealing with companies, I'm sure, on this question. What do you think are things that employers need to be aware of walking into this moment where they will have some employees who will accept the vaccine and celebrate it and others who will not? What are you advising your clients to do?
Well, we're advising them first to know who those employees are, right? To conduct a survey. How many people are willing to take a vaccine? What is their thought about it? What is their position on even coming back into an office? Because people have choices now. So first to know what their people want, and then how do you address it? And then make policy around it. Some of it may be if somebody refuses to take the vaccine, then they're not allowed back in the office. The employer can certainly make that and say, you're going to watch these meetings continuing remotely, and those who want to gather and can gather safely according to standards will do so. So there are options, but again, it goes back to knowing what your people want and are willing to do, and how can we try to accommodate that, but also have to keep everybody safe.
Yeah, Barbara, what's your take on this question of vaccine?
You know, in the end of everything that we've just been talking about, I'll wrap it up very quickly. We're talking about women's voices and being heard. In the Drive Center in 2019, we published a research chapter. It's available on our website to look at. And looking at the data, we found not enough gender diversity in the C-suite and at the top level of leadership. And so we need women in key positions that will ask the questions relevant to women and will listen to women. And so that's what we need. We need women's voices heard. Comfortable, not comfortable, going back. You know, I put this in the context of, even though my kids have not gone back to school face to face yet, well, we're going to be in summer soon. So what are we going to do for summer? Because, you know, school's going to be out. So listening to women's voices and what they can and cannot do, and being mindful of this motherhood penalty, this tremendous burden. Women are incredible creatures that work very, very, very hard, and sometimes they just don't get compensated for what they're doing. And so we just need to be mindful of everything that is on most women today, and employers can increase attrition, retention by having policies that support women who are ultimately, most of the time, caregivers.
That sounds like a great point to end on. A beautiful job of wrapping that up. Dr. Barbara Blake Gonzalez, thank you for being with us from Old Dominion. I appreciate it. Jane Dittmar, thank you for being with us from the Commonwealth. I wish you continued success as you try to navigate policy that will be helpful to women who have been so dramatically affected by this crisis. Abby Hamilton, thank you for joining us from the Roanoke Valley with an important reminder about the Alice population. And these are often the folks upon whom we have relied for the last year. So let us not forget about them moving forward. And Cathy Alvarado, thank you so much for guiding so many companies and for giving us great advice this morning when it comes to how we navigate not only making work something that women can feel more comfortable about doing in various circumstances, but also talking through with us some of the very significant realities that are present right now as the vaccine becomes more available. I want to thank Cox Business and Inside Business, my very fine colleague Sarah Kingsley, who did a great job in her first venture out running the behind the scenes here and putting up the poll questions. So very much appreciate that. And we appreciate all of you who have joined this morning. This is a quarterly series. If it's new to you, please know that it can be part of your life every quarter. Free service from Cox Business and Inside Business. They're always great speakers and guests, and I don't know where else you're going to get this kind of insight in the course of an hour. So as the next notice comes out, I do hope you will continue to join us. You do have an opportunity to sign up for updates from these organizations that will let you know when the next session is, but it will be, I'll give you a heads up, it will be in June. Okay, hey, thanks everybody for joining and have a great day. Take care. Bye.